The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to demonstrate how to transfer an individual from the bedside chair to a bed using a standing pivot technique. This technique may be useful for someone who has weakness in their legs or who may need some assistance with balance during the transfer. An assistive device will not be used in this video. Prior to initiating the transfer to the bed, you should consider the patient's potential to tolerate the transfer. Recognize that simply sitting up in the chair for a period of time can be fatiguing. The amount of assistance needed may be greater for the transfer back to bed than it was for the transfer to the chair. The first thing you'll notice in the video is the proximity of the bed to the chair. To maximize safety during the transfer, you want to minimize the distance the patient needs to travel. If your patient is known to be able to bear weight fairly well and can even ambulate, it may not be necessary to have the bed this close. However, the medical and therefore functional status of our patients can change, so if the patient's ability to complete the transfer successfully is in question, it will always be most safe to have the bed this close. Fasten a gait belt around the patient's waist near her center of mass. Then ensure that her feet are positioned firmly on the floor. You may need to assist the patient in scooting forward in order to position her feet appropriately. Next, make sure the patient has a wide base of support and her feet are pulled under her as much as possible. She's going to lean forward as she stands so that her center of mass moves over her base of support, and pulling the feet back places them in the best position. Instruct the patient to push off from the armrest of the chair to assist with the sit-to-stand movement. As I help the patient stand, my feet are in a wide stance and I keep my back straight. I assist the patient up by using the gait belt to direct her center of mass up and forward on a diagonal. Next, I'm going to maintain contact with the patient with the gait belt as she shifts her weight back and forth to turn. I keep my feet in a wide stance as she does this because this will make me the most stable. The patient contacts the bed prior to sitting, and I squat down, keeping my back straight as I help her control her descent onto the bed. A variation on this transfer technique is to provide additional assistance to help the patient keep one knee extended. To help transfer some patients, you may need to block one leg, usually the weaker one, if they have some asymmetry of strength. This is done by first placing your foot along the outside of their foot and placing your leg across their upper shin. Make sure your other leg is positioned shoulder width apart and slightly behind the leg that is blocking the patient's weaker leg. Assist the patient into standing, as was described in the stand pivot transfer without the knee block. The patient then pivots or shuffles her feet toward the bed. As the patient pivots her feet toward the bed, you may need to keep the weaker leg supported by having your leg against her upper shin to keep the leg from buckling. Lower the patient into sitting, as was described before, while maintaining contact with her weaker leg. If the patient has one leg that is stronger than the other, it is helpful to have the patient transfer towards their stronger leg. For example, if the patient has right-sided hemiparesis following a stroke, ideally the bed that the patient is transferring toward is on their left side. The transfer will be easier if you transfer towards the patient's strong side, and thus safer for you and the patient. Of course, if the patient had transferred towards their stronger side going to the chair, recognize that on the way back they would be going towards their weaker side. If the patient has been sitting up in a wheelchair, the easy remedy is to just turn the chair around or move it to the other side of the bed. However, if the chair or even the bed can't be moved, you should at the very least anticipate that the patient will likely need more assistance going towards their weaker side. If strength is fairly equal in both legs, it does not matter to which side the patient transfers. Also, if the patient has one leg that is stronger than the other, it might be helpful to have the individual pull the stronger leg back relative to the other one, so that it is closer to the chair prior to standing. This position allows the stronger leg to raise the body most effectively to a standing position. Both feet should still be shoulder width apart. If the individual does not have one leg that is stronger than the other, positioning one foot posterior to the other is less important. But you should still ensure that both feet are shoulder width apart to maximize the patient's ability to balance once they are in standing. Lastly, the knee blocking method shown in this video is the one that I personally prefer and find easiest to do. However, there are other methods to block knees during transfers, such as using both of your legs to block one or both of the patient's knees. I would encourage you to consult your therapy staff to determine how to best utilize these techniques with individual patients.